Hello, I'm Dr. Simon Quinn. I'm a vascular surgeon here at St Vincent's Private Hospital, Northside. Today I'm going to talk to you about diabetic foot disease. This is a common problem that can result in serious consequences, which on the whole are often preventable. People with diabetes are at higher risk of developing problems with their feet. The process of diabetes frequently results in malfunction of the peripheral nerves, resulting in reduced sensation and altered foot biomechanical changes that can impact on the function of feet and their propensity for developing infections or ulcers. In addition, diabetes can affect your arteries, which influence the blood flow down to your feet, creating an additional risk of ulceration or infection. Perhaps the most important thing that you can do is look after your feet on a daily basis. It's essential that monitoring your feet is part of your daily routine when you have diabetes, because really prevention is better than a cure. All patients with diabetes should check their feet on a daily basis. Checking your feet means visually inspecting them, looking for sores or ulcers, looking for redness or swelling. Picking up on these symptoms early can prevent serious problems if the diagnosis is delayed. If ever you step on something that penetrates the skin of your foot and you're a diabetic, it's essential to seek medical attention. Peripheral nerve damage associated with diabetes is one of the major causative factors for diabetic foot disease. Symptoms of nerve damage include reduced sensation in the toes or feet, in the distribution of a sock or stocking, pins and needles or tingling or numbness affecting the toes or feet, and alteration in the shape of feet, particularly with clawing of the toes. The major problem with nerve damage affecting the feet of diabetic people is that it reduces the sensation. Injuries or problems with the feet that may otherwise cause painful stimuli are often painless, and thus diabetic foot infections or problems can progress rapidly and to a serious point without diabetic patients being aware that the problem even exists. Another component of diabetic foot disease is reduced blood circulation. This is due to the arterial disease associated with diabetes. Frequently, people with long-standing diabetes have narrowings or blockages affecting their tibial arteries. They're the blood vessels between the knees and the ankles, and these blood vessels can develop narrowings or blockages. The small blood vessels down in the feet and toes likewise can be affected. Poor blood flow to the feet and toes can result in reduced healing and a higher propensity for ulceration. My top tips for caring for your feet as a diabetic: number one, prevention is better than the cure. Daily checking of the feet for signs of infection, ulceration or sores forming is essential and should form part of your daily routine. Number two, wearing good quality enclosed shoes is also an essential part of your routine. And number three, acting early if there's something that's been identified by you or another healthcare professional as being worrisome or a problem can prevent serious complications. And finally, having a regular relationship with a good podiatrist. My role in caring for diabetic feet often involves people when they've reached serious complications and dealing with impaired blood flow and or infections in the feet. My preference would be for you to avoid these problems altogether, and managing things actively before they become serious is the best way for that to occur. However, as a backup, involvement of a vascular surgeon may be able to prevent even worse complications.